Hey guys, today we're going to talk about pain in the thoracic spine. Now, the reason why we're going to go over this is because in my office, a lot of people come in dealing with this, whether it's because of the amount of time we spend on our devices, our phones, that have us in this rounded back, hunched forward position. We see it a lot of times in our pregnant patients. After they deliver their babies, they spend a lot of time feeding, holding baby, and in that position, it starts to pull them forward. The pain in that middle of the back can be really debilitating. It can really keep us from doing the things that we want to do. And so I'm going to give you some tips to be able to take care of that. Now, the reason why this is happening is because there's some kind of motion that's pulling us forward. Our spine gets used to being in that forward position. And so what happens is the muscles and the ligaments and all the soft tissue, the spine is molding itself into that improper position, and it gets really challenging to even want to be in that more normal position. But we've got to do it. And so we're going to train the spine to be able to do that. Now, there are a number of different ways that we can do it. I'm going to give you one simple tool technique today to be able to accomplish this. This here is a lacrosse ball. It's quite large, almost tennis ball size. It's very, very firm. There's not a lot of give in this lacrosse ball at all. You can either take two and tape them together, or you can order something like this on Amazon with two of these lacrosse balls. And what you do is you're going to want to place it in the middle of your back. Now, I'm going to show you here on the table so you have a better understanding of what this looks like. So let's go ahead, we'll move the camera over, and here's what this looks like. So you take our double lacrosse balls, you place them behind you, and you lie back. You want to make sure that those balls are right in the middle of the spine, not off to one side or the other, or they're going to create a lot of pain. And you find that area where the muscles are really tight, where we're not getting a lot of movement there at all. And once you get into that position, you put your arms up over your head and you bring them back. And you go back as far as you can. And you hold that position for a couple of seconds, and then you come back up. We'll even let the legs go here, and you'll bring it back down. You'll hold that position for a couple of seconds, and you'll come back up. And you work on creating more mobility, more space in that thoracic spine. And when you feel that area relax, you move yourself around again until you feel that spot where it starts to catch one of those muscle knots, one of those fixated areas, and you do it again. And you just keep going until you've done this, gosh, 40 to 50 times is what you want to work up to. Now, the first couple times you do this, you might not feel like you can do very many of them at all. But over time, things will become more mobile, you'll get better at this activity, and you'll be able to do it more. It'll give you more mobility. And over time, you'll be able to be more upright. You'll be able to have more mobility and flexibility in your thoracic spine. You'll feel a whole lot better, and it'll improve your posture. And when it improves your posture, we look better, we feel better about ourselves, and that's something that's really important. Hey guys, I'm Dr. Emil Tompkins. So we talked about how to improve thoracic spine mobility. Find some lacrosse balls and give that a shot yourself. If you have any pain or problem with that, or that exercise bothers you, you're going to want to see someone who can help identify the underlying spinal structural issue that's creating that. Your family chiropractor can do that. We can do that. If you live in some other part of the country, send me a message. I'll be happy to find someone for you. Guys, I'm Dr. Emil Tompkins. I hope you have a great day, and we'll see you soon.